Fox Focus. A few minutes for a closer look.
Hi there. Thanks for watching Fox Focus. April is Oral Cancer Awareness Month. Almost 42,000 Americans will be diagnosed with oral or throat cancer this year alone. And sadly, the 5-year survival rate for these patients is only slightly more than 50%. So here to talk about this deadly disease and some ways to prevent it, we brought in Milwaukee dentist Dr. Gequillana. Oh, I pronounced that wrong, but your patients call you Dr. G, is that right?
Close enough, close enough.
Dr. G is with us. Thank you for being here today.
Thank you for having me.
And I was actually pretty stunned looking at these statistics. 42,000 people diagnosed, the survival rate over 5 years, slightly lower than 50%. And there are some parts of the population that are affected by this more than others, right, Dr. G?
More predisposed to it,
okay,
correct.
Like
correct.
who?
Like the African-American population, most certainly men more so than women.
Okay.
And the reason for that, I suspect, is because of chewing tobacco, smokeless tobacco, however you want to call it, chew, dip, snuff. And also, I have a feeling that more men tend to be smokers more so than women. And that's why the incidence is higher in them more so.
Okay, so we are talking about these risk factors, and those are the risk factors. Are there other reasons why?
There are significant other risk factors: excessive smoking, excessive drinking, also excessive exposure to sun in and around the oral cavity, the mouth, the lips. Also, there are some genetic predispositions which can affect hormones and immunosuppressed individuals as well. And more recently, with the incidence of human papillomavirus, that has been related to oral cancers as well.
Really? I didn't know that.
Yes.
I think some people have probably seen these graphic images of oral cancer. Is that always what it looks like?
No, it can be so tiny. It can be the size of a tiny, tiny pimple, or just a little reddened or white area in the mouth. So it could be easily missed. Wow. Easily missed.
Wow. Are there ways to prevent oral cancer?
Absolutely. Obviously, smoking cessation. It's hard, but you know, there are many avenues to smoking cessation. Also, decreasing the amount of alcohol intake, using sunscreen in and around the lips to protect that. Most certainly, all these factors can help to prevent that. And
I would imagine, as with other forms of cancer, early detection is probably critical.
Absolutely, absolutely.
So how would someone go about detecting?
Well, from a dental standpoint, when individuals come in for what we call a recall exam, that's when they come in, see their hygienist, get their teeth clean. The dentist then comes in. We do a head and neck exam, beginning extraorally, and from the dental standpoint, we're focused on here to here. Okay. So at the base here, we're checking the thyroid, and then after the exterior, we go intraorally, check to see the teeth, obviously, the gums, the health of the gums. Then we're looking at the floor of the mouth, the borders of the tongue, the sides of the tongue, the top of the tongue, the roof of the mouth, and anything that doesn't look symmetrical. So, you know, we're made symmetrical. So if there's a lesion over here and it doesn't present itself over here, that kind of raises a red flag. So lesions could be red or white in color.
Okay, certainly something that just the naked eye in a patient probably wouldn't be able to find.
Exactly.
So definitely see your dentist.
Exactly.
Thank you, Dr. G. For more information, see WDA.org and to find a dentist there as well, and mouthhealthy.org, also an excellent resource. Dr. G, thanks so much for coming in today.
Thanks for having me.
We'll see you on the next Fox Focus.
Interested in appearing on Fox Focus? Email us at foxfocus@fox6now.com.